I'm Jaymi Ross, and this is Haley Black, and we are students at Marshall University, and we are here to talk to you about stroke and aphasia awareness today.
Did you know that someone in the United States has a stroke every 40 seconds? Strokes kill more than 130,000 Americans each year, and many people who do survive become temporarily or permanently disabled. So now you're probably wondering, what is a stroke? A stroke is a common condition that causes brain cells to die due to a lack of airflow to the brain that is caused by an abnormal brain blood vessel, and it's normally either a blockage or a rupture. And people who are at risk, some lifestyle factors include weight, diet, physical activity, smoking, and alcohol consumption. And medical conditions that may put someone more at risk include high cholesterol, high blood pressure, and diabetes. Now you're probably wondering, how do I know if I'm having a stroke or if someone around me is having a stroke? And the easiest way to remember this is the acronym FAST. F is for face, ask the person to smile. Does one side of their face droop? A for arms, ask the person to raise both arms. Does one arm drift downward? Speech, ask the person to repeat a simple phrase. When they do this, is their speech slurred or strange? And T for time, if you observe any of these signs, call 911 right away. Early treatment is essential, so you want to make sure you're waiting for an ambulance so the person can receive medical care immediately. Every second counts during a stroke. And some common difficulties after a stroke may include a difficulty with speaking, a loss of vision, hearing, or touch. There may be muscle weakness or an inability to move, and there may also be problems with swallowing and pneumonia.
So 15% of individuals under the age of 65 get, after their first stroke, develop a disorder called aphasia. This percentage increases to 43% of individuals that have had a stroke when they are 85 years or older. So what is this disorder of aphasia? Aphasia is an acquired language disorder that is a result of an injury, typically to the left side of the brain. This is because the left side of the brain is where your language is housed. It affects spoken, written, and written language. It also can affect language and reading comprehension. There are different types of aphasia, and aphasia is typically classified if the patient can speak fluently, so if they speak connectively, if they can comprehend what is said to them, and if they can or do repeat themselves or others. There are different types of aphasia. These include global, which is our most severe type of aphasia. Patients can understand and speak very little of language. Then we have Wernicke's aphasia. In this form, the ability to grasp the meaning of spoken words is impaired, but they can produce language and connected speech easily. Therefore, it's referred to as a fluent aphasia. However, the speech is far from normal. We call this something like word salad. It kind of is all chopped up and weird. And then we go into Broca's aphasia, which is speech output is the issue, but they can understand it. So their utterances are 4 words or less. And then we have anomic aphasia, which is the inability to supply the words for things that they want to talk about, particularly the significant nouns and verbs of their sentences. Speech can be fluent, but grammatical syntax is kind of impaired. Then we have a mixed non-fluent aphasia. It resembles Broca's aphasia. However, they remain limited in their comprehension as well. And then we have primary progressive aphasia, or PPA. And this is language being affected by things such as Alzheimer's or other degenerative disorders. In this chart, you can see how we break down how you can figure out what type of aphasia you have. You can ask questions like, is the speech fluent? And then yes or no. If it's no, you follow the gray. And if it's yes, you follow the red. And then you keep asking yourself the questions of, do they comprehend what is being said to them? And can they repeat me? Or when they try to repeat sentences back to me, are there extra words or no words in those sentences? It's estimated that 1 million people, or 1 in 250 people in the United States today, are living with aphasia. With such a prevalence, it's important to see what life with aphasia is like. Some common difficulties people with aphasia may face include communicating their medical needs, communicating with their family members, especially in groups or individually, talking on the phone, ordering food for themselves, partaking in leisurely activities involving heavy communication. So like chess groups where you're sitting and communicating with your friends, team sports, also certain careers. It's estimated that some people with aphasia cannot return to their original career because it's so heavily relied on communication. How to best support a person with aphasia? It's important to work together with your loved one or your friend. It's also important to understand their needs first and to advocate for them. Always try to advocate for what they need in their communication goals. A way to do this is to provide aphasia-friendly communication. Some have AAC devices, like seen below, or even picture menus like seen, so they can point to what they want, whether they want a hot dog with just ketchup or with everything. How to best communicate with the people you are around that have aphasia. It is important to keep it simple. Speak in short, simple sentences. Be patient. Allow plenty of time for a response. Talk with the person who has aphasia, not for them. It's very easy to try to communicate for them. However, it's important that you let them attempt to communicate for their own. Try to remove all distractions such as TVs and radios and background noise. That's like when we said it could be difficult to be in groups. Try to limit the amount of people talking at once to help best support their communication. Be creative. Don't just rely on your typical communication of face-to-face talking. Try writing things down, using gestures, drawing pictures, and you can also bring in some smartphones and tablets and technology. Also, it's important to always confirm what you heard and what they meant. It's not going to bother them if you just confirm that their needs were communicated properly. It's important to remember that even though communication is different, it does not change who they are as a person. They are just as smart and just as well developed as they were before they developed aphasia. Aphasia does not affect intelligence at all. It just affects how they communicate what they need. So with all that said, we're providing some resources here. We have online support groups, the Caregiver Bill of Rights, so you know what your rights are as a person who cares for someone with aphasia, some communication guides, and the caregiver guide. These are all provided by aphasia.org. They also have some wonderful resources on there for other things, as well as it breaks down as I am a person with aphasia, I am a caregiver, or I'm a medical provider. So you can go in and find resources for your specific needs. Here are the resources we used to create this PSA today. Thank you and have a wonderful day.